Welcome viewers. Welcome to another session of Get More from Mallapuram. So on the month of Women's Wellness webinar series, we have an expert led session by Dr. K. Anuradha is with us. She's the director of Anu Test Tube Baby Center, fellow of Royal College at Obstetrics and Gynecology, London, actually. So we welcome you, ma'am, for this session. So the topic we are going to proceed with is regarding PCOD, understanding PCOD. So we like to hand over the session to Anuradha, ma'am. Ma'am, please.
Hi, hello, and good afternoon, everyone. I'm not sure how many have joined, but thank you all for joining us today. I know it's a Saturday, Eid, and post-Ugadi, but still, at least some of you have made an effort to join us. I'm always actually fascinated with the kind of work you all do, especially the software profession. I mean, I feel it's more like a Greek and Latin for me, like the computers, the systems, and all that. Maybe because in the early days, we had only medicine and engineering as the proper professions, and that's the reason why we are still backward into the computer systems and all that. So I'm really fascinated, interested about how you really manage with all your kind of work, because you deal with so much of innovations, the advancements, and the technology. And now I think with your AI and the robotics, you're taking the world to a completely different level. So hats off to you. But then I think there's a lot of pressure, the work pressure, there's a lot of workload. You're doing really hard work. And this is what is associated with different kinds of problems. You need to show your performance, the night shifts, sleepless nights. So all this, you're doing a great job, but then actually it's paying a toll on your life and the rest of the system. So today we are going to talk about something about it. So let's share the slides with you.
Yes, ma'am. Sure.
So as you've been already told that we're talking about understanding polycystic ovarian diseases. So all this kind of stress, what you're going through, long working hours, sleepless nights, irregular diet, the shift systems, so not having proper night sleeps, I think this all leads to different kinds of gynecological problems and different kinds of medical problems. So just to name some of them, they're called polycystic ovarian syndrome, the menstrual syndrome disorders and irregularities leading to heavy bleeding and dysmenorrhea, conditions like endometriosis, which can cause severe pelvic pain and fatigue, and chronic mental stress. So today, I would actually say that we should be thankful to our organizations who have actually taken care of all our problems.
Thank you, ma'am. Thank you.
And because at least you're trying to have a health awareness programs. I have to go back. Health awareness programs and then creating all this. And now today we are here just because of that, to increase the awareness. Sorry, I'm just trying to shift my slides.
Yes, ma'am. No problem.
So for the condition what we are worried and what we want to talk about today is about polycystic ovarian disease or polycystic ovarian syndrome. So we are actually linking both problems, polycystic PCOD and PCOS. So what is the difference and what actually PCOD is? The main thing, everything is in the name, polycystic ovarian disease. So that means there are multiple cysts in the ovaries, and that is why it is called polycystic ovary, and this is what leads to hormonal imbalance and causes a disease called PCOD. So this is one of the commonest endocrine problem and it affects nearly 10 to 15% of reproductive age women. So that means 1 out of 8 or 10 women are actually affected with this kind of a problem of polycystic ovarian disease.
Okay.
So in this, what happens? One thing is you will see cysts in the ovaries, high levels of male hormones, which are called androgens, the cycles which are skipped or maybe irregularity in the cycles. So how do you differentiate? So now we've been talking about PCOD and PCOS. So what is the difference between them? So PCOD, you see, is a little milder form, whereas PCOS is a little more severe form as compared to PCOD. So PCOS is a cluster of conditions that actually occur together, at least 3 out of the 5 metabolic risk factors. So the metabolic risk factors, what everybody, should be aware of, which can actually lead to other kinds of diseases in the later part of the life. One is abdominal obesity. Like if the waistline, especially in women, if it is more than 35 inches, then that is called abdominal obesity. And in men, it is more than 40. And if you have high triglycerides, more than 150 milligrams per deciliter, or low good cholesterol, less than 40. If you have a blood pressure, normally most of the times what we do is we keep checking the blood pressure very often. And then even if it is 140/90, we consider it to be normal. But anything above 130/80 is not normal. You need to have regular checks to make sure. A fasting blood sugar more than 100 is also not normal. So one need to actually go through the rest of the screenings or to see a physician. So why is this happening? Why the metabolic syndromes are increasing? This is related to the lifestyle or the insulin resistance. So if you have 3 out of these 5, then it is called a metabolic syndrome. And if the metabolic syndrome is associated with a polycystic ovarian disease, we call this as a polycystic ovarian syndrome, not a PCOD. So most often PCOS is a little more severe form. But what happens in PCOS or PCOD? It actually has different kinds of features. So it's not that one person will have only one feature or everybody is going to have one kind of a particular feature. So presence of one single feature is not characteristic. You need to have at least 2 out of the 3. So if you do an ultrasound scan and you come across with lots of cysts in the ovary, so you can see the difference between this ovary and this ovary. So as soon as you just look at the picture, even a lay person can make out that this ovary is not normal. So in these kind of a picture, ultrasound showing polycystic ovaries is one of the features. The other is having some symptoms and signs of high male hormones or called androgens. Or the other symptom is irregular cycles. Suppose somebody is having a missed cycles, any cycle more than 35 days, or suppose you are having lesser than 9 periods in 1 year, that actually is called an irregular cycle. So if you have at least 2 out of these 3 features, then we call it as a PCOD or a PCOS. Not just if you have irregular cycles, we just brand you like PCOD or a PCOS.
Here I have a question. No? Please go to the other slide. No? Previous slide.
Yeah.
So the signs of high androgens you have told actually. So actually, can you elaborate it a small?
Yeah. So when the male hormones are more, then you can have different kinds of symptoms. The androgens, you can have excess facial or a body hair, acne skin, oily skin, thinning of the scalp hair thinning, hair loss. There could be darkening of the skin tags. So all these kind of changes you come across when there is an increase in the male hormones. So whenever you see that there is a change because there are some patients who do complain that, okay, I have more hair now, which I'm observing for the last few months. And this actually also is associated with obesity. So somebody who puts on weight in the recent past actually starts showing up more hair growth also. So androgen levels are higher in those who are obese or overweight. So these are all the symptoms of increase in the male hormones.
Also. Okay.
Yeah.
Yes, ma'am. You can continue. Thank you.
And the other symptom could be a weight gain. So nearly 80% of women with a PCO are overweight or obese. So what they normally experience is there is a sudden weight gain, and then what the complaint is that, okay, they've been trying their best, but then still they have a difficulty in losing weight, and especially around the abdomen area. So this is what is one of the common features in polycystic ovarian disease or a syndrome. And the other problem is about the mental health impact, because they usually feel a lot of fatigue, mood swings, irritability, not being able to sleep. So all these changes are because of the hormonal disorder which is associated with PCOS.
Okay. But ma'am, mood swings are the regular signs in a menstrual cycle also. So how
Correct.
can we differentiate both of these things?
So normally if it is associated with the menstrual cycle, then it's cyclical. Like it's not that you have it continuously throughout the month. But a polycystic ovarian disease, usually because they have high estrogen levels and a low progesterone, so they usually have this higher estrogenic effect continuously. So it's not that it affects during the menstruation or just before the periods, but it also affects continuously. So that is how you can differentiate. So if it is happening once in a while, that's normal. It's just because you have mood swings, you don't have to go to the doctor. But then if it is happening continuously, then you have to see whether
Then
you
we
miss
have to,
medical.
okay.
So then it can also lead to fertility issues. So what kind of fertility issues? One is irregular cycles which lead to absent ovulation. So normally every month one egg is released, and this is what is picked up by the tube, and this helps for the pregnancy. But in a polycystic ovarian disease, there are a lot of cysts in the ovary, and there's a lot of hormonal imbalance, and there is no egg development. So that is the reason why the cycles are irregular. And this absent ovulation also leads to a delay in a pregnancy. And because of the higher androgen levels, the egg quality is also low. Not just that, there could be associated implantation issues, mainly because the endometrium which forms during the development of the oocyte or because of the estrogen, this thickened endometrium is shed off during the cycles. But then when there is no period, then the endometrium is not shed off. Every month it's actually thickening and it's not getting shed off. And when there is a shedding off, because of the low progesterones, there could be irregular shedding also. So all this can lead to implantation issues, and this all can cause fertility issues. So it has diverse kind of symptoms with the PCOD. So why do we really need to understand about PCOS? Because we
excuse me, ma'am. Here I have to tell the viewers. Yes, please, any question is there, you can post in the chat box so that we can ask ma'am and she can reply it. So continue, ma'am, please.
Many people are so much aware, there's so much information, so I'm sure they get all the answers from the chat GPT or the
correct. Actually, I think this is a vast subject. So a lot of confusions and lot of questions are there in the viewers' mind.
Correct. It's always it's good to clear them up rather than cluttering in the brain. Yeah.
Yes.
So what the worry is that PCOS is actually increasing. The incidence is increasing in India and all over the world also. And it's mainly because there is a twofold increase in a BMI, that's obesity or overweight, and there's an increased risk of PCOS. So I'm sure you must have come across with many who would actually say that I've been traveling a lot, or those who have gone from India to other Western countries, and the change in the diet, the change in the environment, they put on weight, irregular exercises, and then they have irregularity in the cycles. So the one who doesn't have a polycystic ovaries, because of the lifestyle, it changes. And then they can develop PCOS even if there is no genetic reason for that. So with the obesity, overweight, changes in the lifestyle, there is an increase in PCOS, which we are seeing very often now. And nearly 60 to 80% of women with PCOS has androgen abnormalities. That is increase in the male hormones. There is an increased risk of sleep disorder breathing, because normally at night when you're sleeping, suddenly you wake up because you're not able to breathe properly. And sleep apnea, this is very common in PCOS. There's an increased risk of diabetes, hypertension, which is more. And also because the endometrium is not shed off every month, there is something called endometrial hyperplasia. It starts getting thickened every month. And this can also lead to problems like endometrial cancer in the later half of the life. So these are the main worries which are related to PCOS.
Acha. So it means because of PCOS, it is next step. It will be causing diabetes also, ma'am.
Yes. So actually, the PCOS does not mean that it's only a fertility issue or irregular cycles, but also that it can lead to long-term risks like diabetes, hypertension, and other problems also like endometrial cancer, hyperplasia, bleeding problems. So it's not just the short term; it can continue for a longer time also.
Okay.
So that's why we need to be.
We have a question here, ma'am.
Yeah.
Does conceiving affects due to PCOS short term?
Yeah, it can.
I think their intention is if PCOS or PCOD is there, can a woman conceive in short time period?
Yeah, the woman can conceive with a PCOS. It's not that they cannot conceive, but then there might be difficulty in most of the patients, not necessarily everyone. So many times you come across with women that you diagnose that they have PCOS during pregnancy, or so it's not necessary they're going to be definitely infertile or subfertility. So they can still conceive, yes.
Okay. Yes, ma'am.
So we just want to know why it happens. What are the main reasons for this? So we know there is a hormonal imbalance, and this is all controlled by hypothalamus and the pituitary, which is at the higher centers of the brain. So normally there's a negative feedback mechanism which operates through estrogen secreted from the ovaries, and this actually helps in production of FSH and the rest of the estrogens, and that helps in the development of the egg. I'm not going to go into the details, but it just shows that it's our brain which actually controls our ovulation and the PCOS also. So, but in PCOS, because there is an irregular signaling, the androgen levels are high, there are other hormonal imbalances. So that leads to a polycystic ovarian syndrome. Normally, every month, a woman who is ovulating, so every month there are hundreds or 50 of eggs which starts getting recruited. So normally what we all think that, okay, one egg every month and we are losing only one egg every month. It's not like that. So every month for one egg to be produced, you have at least 50 to 100 eggs which start developing. And then some of them get selected and only one becomes dominant. So you start losing the rest of the eggs, which have started to develop, but then they shrink because they're not useful for that particular cycle, and only one egg develops. Whereas in PCO, so because there is no recruitment, there's no selection, so all these follicles stay in the ovary itself. So that is the reason why we see them as a PCOD. Like you see lots of follicles in the ovary. So that actually is also a good thing in a way because you don't get menopause early when there is a polycystic ovarian disease. So there are some good things in that also. And the other thing is because nowadays we're seeing a lot of women with diminished ovarian reserve. Young people losing their eggs very early. That's what we are seeing very often. So PCOD is one extreme and diminished ovarian reserve is another extreme. So in a PCOD, you have good number of eggs and you're not using them up. In a way, it's positive because you can use them at a later date. So the other reasons what we think is insulin resistance, higher androgen levels, and the genetics. So the genetics also plays a role in this. So in 30 to 80,
it can be PCOS or PCOD can be hereditary, ma'am. It can pass to the next generation.
It can be hereditary. Yes, it is hereditary. It is possible. So it's not necessary every time, but it can be hereditary. So this insulin resistance is seen in about almost 30 to 80% of the cases. So every time there is actually a confusion about what is meant by insulin resistance. We hear it so much everywhere, but what it is. What happens is whenever we eat food, the pancreas actually produces a hormone called insulin. So this actually helps the cells in the tissues to uptake the glucose so that the cells can have the energy. But in these patients with PCOD, PCOS, or metabolic disorders, the cells are not able to recognize. There is a lot of insulin around the blood, but then it's not able to recognize, and the insulin does not help the glucose to go into the cell. So this, in fact, actually signals the ovaries to produce more androgens.
Okay.
And the glucose do not enter the cell. There is not enough energy, and this actually sugars are stored in the fat.
Okay.
So you have a lot of sugar in the blood, but then because it's not reaching up to the brain cells or the rest of the body, then you feel very tired. You feel hungry more often, especially the PCO. You think, okay, yes, they're so obese, they have so much of fat stores, but still, why do they feel so hungry? It's all because of the insulin resistance. And then you start eating food again, and then again this vicious cycle goes on. So this is what is the major problem with the insulin resistance.
So we have a question here, ma'am.
Yeah.
Just a minute, I will open the chat box. So Mrs. Lakshmi has asked, is PCOS or PCOD problem increasing vastly in recent times than the last few decades?
Exactly, it is. It's increasing a lot.
Okay.
So we see now two extremes. A normal woman with a normal number of eggs or the follicles in the ovary has become very less. We see either a polycystic ovarian disease with too many follicles which are not being used up, or the ovary which is exhausted of the eggs. See, the two extremes, we're seeing it very often now. So I can't say which is more, but both of them, we're seeing it very often now. So it has become very common, yes.
Yes, ma'am, correct.
So you were asking about the role of genetics.
Yes, ma'am, correct.
So this is actually an autosomal dominant. So if mother is affected, 10% of the girls will have a polycystic ovarian disease. If you have a sister who is affected, then you have a 40% risk that you will also get a polycystic ovarian disease. So that means that if your sister is already affected, so that means she has a genetic inheritance risk, and you will have a 40% risk along with that. So the risk is there, which increases genetically also.
Okay, okay. But in general, when mother is having some related issues, the kids will have more percentage, no ma'am? Why your sister is having more percentage and mother is
Exactly.
40% is there for sister, and for mother 10% is carrying on.
But then what you don't really know is that whether mother had a genetic problem or not. If mother had a genetic problem and this is autosomal dominant, then it will be carried on to the child.
Correct.
But then if already a sister has a problem, so that means that already there is a problem. So you have a higher risk that you are going to get it.
Okay.
So
Okay.
that means there is a genetic cause. I mean, that actually gives you a clue. If you have a sister in the family who is an elder one and has a PCOD, and sometimes even a younger sister, if you have a problem with a PCOD, though you may not be having a PCOD at that time, in the later part of the life, with the changes in the lifestyle, it can actually pop up. So that also can happen.
Okay, okay. So this problem persists in which age, ma'am? Actually, after maturity of a girl.
Yeah, this actually is a common reproductive age woman. Like that is from 15 to 45 years age group women. But we are seeing more of PCOS in adolescent girls because the puberty is also happening early now. So we are seeing a lot in the age of 11 to 14 also. There are a lot of girls. So that is what actually is concerning. So if the mothers are aware, then they can be a little more careful, even if there is no genetic reason. But still, you can reduce the risk if there is an awareness in this kind of a problem. So yes, it is really increasing a lot.
Can our food style also can change this, ma'am? Actually, we can get aware of this PCOS and PCOD. Our daily lifestyle of food, taking of food also.
It is actually governed most by how we live, how we take care of ourselves. So definitely, it's more than 50% cause is our lifestyle. Correct. So definitely it has an impact on these all hormonal disorders.
Yes.
And so that is what is called epigenetic mutation. So though you have not had your gene from your mother or the parents, still there could be genetic changes in your own body with time. When you're exposed to some toxins, environmental toxins, the plastics, or the lifestyle changes, the obesity, all this can cause, there is no DNA change in this, but still it can cause changes in the genome. So and this can be passed on to your child.
Yes.
So these epigenetic mutations which happens during your lifetime is not only going to affect you, but this also can be carried on to your child, even if you don't have any genetic transmission from your mother. So these epigenetic mutations also can lead to PCOS.
Correct.
So now anyway, we know about PCOD. How do we diagnose a polycystic ovarian disease? So with this kind of an ultrasound, so now every gynecologist, whenever you walk into a doctor, the first test which is done is an ultrasound scan, especially for the gynae, because you want to look at the uterus, ovaries, and though you have symptoms which are completely different, sometimes they may be related to some gynecological conditions. So when you do a scan and you find an ovary with too many cysts in the ovary, then we can diagnose it as a PCO. But you cannot diagnose. You just only get it out.
Okay.
Then you have to diagnose with the rest of the tests also. So you call it as like a pearl necklace sign. You have lots of cysts in the periphery, the ovaries and glands. So there are lots of signs which you can see on the scan. And when you do some hormonal blood test, then you can actually see that there is a hormonal disturbance in the body. You don't really have to do the hormone test, but unless you see male hormone excess signs, then you have to do the testosterone levels or DHEAS test. And otherwise, the important blood tests are the thyroid test and the prolactin. Because most of these times, these PCOS and PCOD are associated with the TSH and prolactin, which is raised, and this actually needs correction. With the correction of this might help to even regularize the cycles. Even the PCOD is going to still be there, but this helps in correction of the cycles and also for weight loss and all that. So these two are the most important tests which need to be done.
Okay.
I'm sure your organizations do all these health checks and all that. So thyroid function tests are done very often now. And maybe, if, I'm not sure if the prolactin is included. If this is included, that also will be helpful for these kind of women.
Okay.
So now we are diagnosed a PCOS or a PCOD. So how do we manage? How do we take the control? Actually, you have a control with yourself. You can actually control it most often, even before you go to your doctor. Because we know it's a lifelong situation. There's no cure, but it is something which is manageable. It's not that you do a fasting for a week or 10 days and then you start eating again in the same way. Though you lose weight, you regain it again. So it has to be, even if it is a small change, it should be something which is maintainable, which is consistent, that actually bring a lot of changes in the symptom improvement. So the important things are the balanced nutrition, regular movement, and the weight management. So these are the things which are really important. So what do you mean by balanced?
Ma'am, can you suggest for our viewers some exercises or some food intakes to be taken to avoid this PCOS and PCOD?
Yeah. The one thing is, if you are not overweight, you can reduce your risk of a PCOD. And if you are overweight and you're obese, you still have to take care of the nutrition part. So, but it has to be balanced. So, I mean, it's not that you just stop eating. You have to focus more on the fiber, the whole foods. So choose more of vegetables, lean proteins, complex carbohydrates like whole grains and lentils. So limit your food intake with added sugars like sodas, cookies, sugary drinks. So all this actually increases the risk of weight gain. And most of the times, because what we do is we are busy with the work, we skip meals, but this is actually what actually causes more problem. You need to have consistent food habits, because this causes otherwise severe insulin spikes. And then again, there is a lot more deposition of the sugar, the fat in the fat cells. So you should not skip meals. You should eat small quantities and more number of times.
And also, can taking of lot of coffee and tea can affect this, ma'am?
If you're taking green tea, it's okay. So suppose you're taking tea in moderation, it is okay. You can tea maybe 3 cups a day, and coffee 2 cups a day. But if you are cutting down on milk and sugar, then it doesn't really cause any problem with the
Like
PCOD.
black tea or black coffee, it doesn't.
Correct.
Correct.
Yeah.
Okay. I know.
And
So
it
we
is
have a question, ma'am. Can late marriages or late deliveries affect PCOS or PCOD?
the problems with time keep increasing.
Yes.
If you're healthy now, it does not mean that you're going to be healthy forever.
Huh.
So you're exposed to so many things. So it's the change in the lifestyle, sometimes the stress. So all this, though you're completely normal now, you may get different kinds of problems later, like endometriosis. You can get fibroid uterus. You can have PCOD. So even if you don't have it now, you can have a problem at a later date. So not having a PCO now, it does not mean that you're not going to have a problem later. So definitely, younger you are, you have better chances of a conception otherwise also.
Okay. So after deliveries also, after giving birth to a child also, can PCOD or PCOS affect one?
Normally, those people
Like
who have a PCOS,
at the time of menopause time or something.
PCOS actually they have menopause which is delayed
Huh.
because they have lots of eggs. They still produce a lot of estrogens. So they
Okay.
have delayed cycles and they have delayed menopause also.
Okay.
Whereas other people, they exhaust their eggs faster and they may have a premature menopause. So this does not happen after menopause because it all depends on the ovary. So if the eggs are completely gone, then it doesn't happen. But because in a PCO, menopause does not happen early.
Okay.
So in a way, it's good also because you need estrogen to have a healthy heart and healthy bones also. So it's not that you wait for a menopause and then it's going to. Whereas problems like endometriosis, problems like fibroid uterus, actually they may reduce after menopause.
Okay.
Whereas
Can this problem lead to some uterine cancer related
yes.
type of things, no?
Yes, it can because you're not shedding off your endometrium every month. And there's a lot of thick endometrium which is still there in the uterine cavity. So there's a lot of development. The cells are growing every month and they're just there. So that causes increased risk of something called endometrial hyperplasia and endometrial cancer also. So the risk is more. These people have an increased risk of endometrial cancer, especially when there is an obesity, diabetes, hypertension, and also PCOD. So the risk is more definitely, yes.
So if a woman is affected with PCOS and PCOD, if one cycle she's producing egg, and the other cycle she's not. So the next cycle she is producing. Can we store this egg for some other time, ma'am?
It's not that you store one egg from one cycle. If you're going for an egg freezing, you have to do freezing a lot. So actually, we'll talk about it also in the next few slides because this is something very, very important.
Yes,
So,
ma'am, you can continue. Yeah.
So, and the important thing is the most important, not just the diet, also exercise. And it's a consistent exercise. So a mix of cardio and strength training, even short walks. Many times we're tired, we're busy. We don't want to, we say, okay, we'll skip today. But then even if you try to push yourself and do 10 to 15 minutes of exercise also will help and make a significant difference. So try to push yourself and then you will definitely feel better after that kind of an exercise. So even if you have a problem, try to maintain some timings and give a little time for yourself also. And what is important to know is to improve your chance of a pregnancy or chance of an ovulation and also to regularize your cycles, a moderate weight loss. You don't have to really lose 50 kilos of weight. But if you even lose 5 to 10% of your normal weight, it makes a lot of difference in the hormonal changes. So it should be a consistent change and that definitely helps to improve the symptoms.
Okay.
So what is important is that you take care of yourself. This all happens because you're so busy, exhausted, you don't have enough time. So give importance to yourself. Listen to your body. Take care of yourself. Manage the stress because this is what actually causes more problems. So do some yoga, meditation, have a good night's sleep. So many a times, like in the night shifts also, you're not able to sleep in the night. You're sleeping in odd hours. And you would say that, okay, anyway, I'm sleeping for 8 hours in the daytime, so how does it matter? It
Correct.
does matter because there is something called a circadian rhythm which happens in the brain, and that
Okay.
actually controls all your hormones in the body. So you should see that in a long term, you don't continue doing night shifts throughout the life. You have to give a pause at certain stage or other. So a good night's sleep of 7 to 8 hours is very, very important to manage your cortisol.
Okay.
So, and then now with all these male androgen hormones, there's a lot of cosmetic changes which happen. So, taking a cosmetic care, now you have a lot of advancements in cosmetology, like laser hair removal, acne treatment. And so you don't even, many a times you don't even know that, okay, the patient has a PCO because 70% of the affected women are undiagnosed because the phenotype of the woman changes. Earlier, when I was working in UK, maybe 35 years ago, we used to call this as teen Leventhal syndrome, a PCOD.
Oh, okay.
So when a woman is walking into the clinic, you see somebody obese, fair, with lots of pimples, hirsutism. So, and then you just do a spot diagnosis. You call it as, okay, now you know you're going to say a PCOD. But now you can't really do it in most of the times. Very rarely or occasionally, it's just that we come across with women who are obese and male hormones because they are going through the cosmetic treatment, their lifestyle modifications which are there. So 70% of the women who have a PCOS or a PCOD, they get undiagnosed. So in a way, it's good because at least the lifestyle is reducing the severity of the PCOS also. But then you have to tailor the therapy. Like, I mean, there's no treatment for a PCOD as such, but depending on what you want to achieve, you treat the symptoms. So you may have to see a specialist or a gynecologist and make a personalized plan. So what are you more worried about? Are you worried about the irregular cycles, or is it the cosmetic part? Are you having I mean, psychological issues? Is it the obesity? So these are the things what you need to, I mean, personalize and take treatment according to that. So normally to regularize the cycles, you have birth control pills. Now we give tablets like metformin because we know it's all insulin sensitizing agent. So earlier days, now people are aware, but earlier days when we used to prescribe metformin, then the patients used to go to the pharmacy and the pharmacy will say, oh, how come you look so young? Why are you given medication like an anti-diabetic drug? So they would come back to us and then ask again, why, doctor, is it a mistake? Why did you give me anti-diabetic drug? So that's why we need to explain and give tablets which are actually anti-diabetic tablets, but they actually help for polycystic ovarian disease also, not just to reduce PCO, also to reduce the weight.
Okay.
Sometimes
So, ma'am, you have explained that when 70% of undiagnosed persons are there. So when we have to go to the doctor, we are not realizing that this is affecting us.
suppose it's not necessary that you have to have a hirsutism, not necessary that you have obesity. With the PCO, you'll have one symptom or other. Either that you have, suppose you're planning for a baby and you're not able to conceive,
Correct.
even if you have regular cycles, then maybe if you go to the doctor and then they would do a scan and do the blood test. Or maybe you already had these problems, but then you had a cosmetic treatment. Then maybe people will not say because otherwise, you know, when there are women who have been trying for a pregnancy, wait for 6 months. So most of the elders, even they would say, why don't you go and get yourself checked because you might be having a PCOD. So it's even if you don't have symptoms, at least one symptom will be there.
Yes, ma'am.
You may have a difficulty in conceiving, you may have irregular cycles, or maybe you had problems and you had the treatment. Like though maybe you're obese and you lost weight. So these all can happen. So it may get undiagnosed also, but whenever there is some difficulty, you should then approach a doctor to see whether you have to make sure that you're not missing this kind of a problem.
Correct.
So the treatment is not just meant for that particular short time of correcting the cycles or having a baby, but then the long-term health problems also we need to think of, like risk of diabetes, keep your BP and sugar checked every time, and the risk of endometrial hyperplasia. So you need to be careful. So you were talking about the misconceptions. So one of the thing is what we think is okay. If you are obese, then only you have a PCO, but it's not true. It's not necessary that all women are going to be obese. There is something called a lean PCOS or a slim PCOS, which affects nearly 30% of the people. So you have to be aware, and whenever there are symptoms, because they have other symptoms, though they might be slim, but they may have other symptoms also.
Okay.
And the other
So,
question
in this PCOS or PCOD, you have mentioned that male hormones are taking place. So, if it is not diagnosed by the patient or a woman, is it possible that total hormones will be changed to a male hormone?
No, it does not mean that because you have an increased male hormone, you will change from a female to a male. No, it doesn't happen.
Okay.
It's just that you have a little more than normal level.
Acha,
So
okay.
that is what actually giving is all these symptoms. So
Mhm.
it will only cause symptomatic changes,
Acha.
like obesity, you have the facial hair, and male kind of baldness. Sometimes genital changes which can happen,
Okay.
but not that it will cause.
Completely it will be changed. Right.
Okay.
Okay.
And not all women with PCOS will have fertility issues. There are many who conceive naturally.
Okay.
Because 60% can still achieve spontaneous ovulation. Otherwise, even lifestyle interventions, weight loss, improved diet can increase their natural conception chances also. And just doing a scan and seeing multiple cysts in the ovary does not mean that you have a PCO. There should be other features also associated to know, okay, you have a PCO or not. And so 20% of normal women will have a picture like this.
Okay.
So just an ultrasound, because many a times there are people who come to us and there is a diagnosis which is made as a PCO. So small says CC, and then you just call them as a PCO. So you can't just do that from a scan picture. You have to make sure. So you should not brand any woman with a PCO unnecessarily. And many women, they keep asking, all this is happening because of my problem with the ovaries. I have so many cysts in the ovaries. Why did you take out my ovaries or why don't you remove the cysts? So most think that laparoscopy is a cure, or puncturing the cysts or removing the cysts is a cure. It is not a cure. See, it is only going to temporarily help. So suppose somebody is planning for a pregnancy and they do not conceive with the simple medication, then we do a laparoscopy. We try to puncture these bigger cysts. So the androgens which are there in these cysts, they get released. So there is a correction of the hormonal balance, and which is temporary. And it does not work for everyone. It only works for those who are slim PCOS. Obese, it does not work that well. And then again, it may work only for 6 months. So it's not a cure. So it's not that you just remove the ovaries. The earlier days, the people used to take out half the ovary so that the normal ovarian tissue was reduced and then the ovulation used to happen. Now we try to puncture the cysts, some of them in the ovary, but it's only a temporary help for some people, not for everyone again.
So again, it can build upon in 6 months. After 6 months.
You can't even say that it's going to work. It might work for some people, and even if it works, it could be a short-term effect. Only thing is the severity will be reduced. Not that they will conceive on their own or it's going to make a lot of difference, but it may help to a certain extent.
Okay.
And we were talking about the egg freezing. Nowadays, I'm sure everybody talks about the egg freezing. So, so one of the patient who just came to me recently, she was saying that we are a group of friends. We all wanted to freeze our eggs. We went to Rainbow, something like that. So I said, why do you want to freeze your eggs? You're already married for 3 years. She said, because I want to build a house. I want to live happily for a couple of more years with my husband and enjoy their life. So that's why I want to freeze the eggs. So, I mean, everybody has their own choices. But then what one need to know is that egg freezing is not a guarantee for a future pregnancy. It only gives us a chance to conceive. And the other thing is, if you have frozen 20 eggs, gives you a good chance for a pregnancy whenever you want to try. So, is it really required in a PCOD? Actually, it's not required. Because they don't lose their eggs so fast. Like the other younger women, they lose every 50 or 100 eggs every month. But it is a good option. Suppose somebody does not want to have a baby right now, it can be done, because with age, the quality of the eggs come down. So you're actually getting better quality of eggs, and you're getting better number of eggs also in a patient with the PCO. Because other people, sometimes they have to go for 1 or 2 more cycles to get roughly around 20 eggs to freeze. Whereas with a PCO, sometimes you get 20 eggs in one cycle also.
Sure.
So you get good number of eggs and you preserve the quality, but it's not necessary that you have to freeze the eggs.
Okay.
The most important thing is, can we prevent a PCOS? Can we control? We
Yes.
know there is no cure, but the lifestyle modification, the healthy lifestyle, it's all in your hands. You have to do it yourself. That's how you can actually control it and you can even prevent. And what is important to know is during pregnancy, it starts. Suppose the mother is exposed to higher androgen levels, which can happen with the diet, a lot of weight gain. So the lifestyle changes. If you're not doing exercise properly, then that epigenetic changes, which is called a fetal reprogramming. So even if the mother is not having a PCO, because of the increased maternal androgens related to the lifestyle changes, so that can actually carry on to the baby, and this can start the changes in the baby itself. And what you have to say is that you're not even just blaming your mother, but you have to blame your grandmother also. Because this baby is going, if it is a fetus baby, female baby, then the ovary is already started to develop. The number of eggs or the follicles are started to develop in at that time, and this will carry on to this baby, this baby's baby. So it's not just one generation, but actually it can carry on with the generation. So you're not trying to help yourself, but you're also trying to help the rest of the generations. Also. That's what is important to understand.
Yes, correct.
So thankfully, I will try to conclude.
Yes, ma'am.
So it is something.
Yes, ma'am. Continue, please.
It's a lifespan disorder, and you have to give a personalized treatment for it, depending on what you really want to achieve in this kind of a problem. And early screening, especially at when they are girls, they're still young, adolescent age. That is when you start the screening itself, so that you catch them young and you have a higher chance to reduce the risk. So, I mean, this is the way you can actually prevent seeing a doctor and getting tortured unnecessarily by taking care of yourself.
Yes, ma'am.
I would love to show our first IVF baby because this was in 95 after we had we started first IVF center in 94 and 95. We had the first IVF baby. Look at the way the baby has been draped. I mean, even the parents could not recognize, because those days, I mean, they didn't want their child to be known as if it is an IVF child. So even the mother could not recognize this picture at a later date, but could at least have a picture. This is
So
Dr.
yes, we need to kudos ma'am. Actually, she is the first IVF process doctor. So it was very good to have you on this session, ma'am. So we'll conclude with the points actually you have mentioned to us today. A great job you have done by polling us long working shift systems, sleeplessness, and PCOS and PCOD, metabolic syndrome, difference between PCOS and PCOD2, and lifestyle correction, 60 to 80% male abnormalities, and endometrial cancers, hypermelanus and pituitary, no resonance, no selection, no dominance, insulin resistance, and genetics. It takes a role of, if it is a sister, it can be carry forward 40%, and it is your mother, it can carry forward 10% to a girl. After that, epigenetic mutations, corrections of hormones. Main test to be done in this is our thyroid and prolactin test too. And managing lifelong no cure. It has no cure actually. We have to manage everything in a PCOD or PCOS situation. So 70% undiagnostic will be also, undiagnosed will also be there here. So, and in utero process will be there. So these are the topics you have concluded, ma'am. We are very lucky to have you on this session today. So can you explain us a little bit, a brief of regular daily routine for a working woman, ma'am?
Well, again, it all depends. It's not easy, isn't it?
Yes,
Even if I say something, it may not really be applicable. They themselves have to make a regular routine, because nowadays we see younger generation waking up at 10 o'clock, 11 o'clock, because their shift starts at 12 o'clock. And then they will be sleeping late in the night around 1 o'clock or 2 o'clock or maybe later also. So you really cannot make a regular routine for somebody. You yourself have to do it.
Okay.
So you have to manage in such a way that you, I mean, if possible, you have a good night's sleep for at least 8 hours, and at least give 45 minutes time for yourself, doing yoga or exercise or
Yes.
walking or whatever kind. It's not necessary to do only yoga or do a cardio, because sometimes it becomes monotonous. You do swimming, play. It sports is so nice. I mean, at least you see people, you come across with a physical activity, mentally you feel good. You see other people. So sports like badminton, tennis, whatever you like. There are people who would like to do swimming. So wherever your interest lies, try to take use of that and do exercise and plenty of fluids. That is what is very, very important. Because many a times we keep forgetting about taking water at work. So at least 3 liters of water or buttermilk every day is very important. And taking meal, short meal or a small meal, and more number of times. So this you have to include in your regular routine. How you manage, you may have to make your own plan, but then it is important.
Okay, okay. So last one, ma'am. These days we see a lot of women taking alcohol and smoking too. So will this impact on this kind of situation, PCOS and PCOD?
It's quite a good question, because this is what we see more often now. Because we feel very hesitant when actually the young girls, they come for a pregnancy or a treatment and all that. Sometimes they themselves actually come out and tell that, okay, I've been taking alcohol, should I stop? But there are some, unless we ask, we won't come to know. So definitely smoking is very bad, not just for your health, but also for the baby and the reproductive health, because it reduces your number of eggs in the ovary. The diminished ovarian reserve, smoking is one of the main causes. And the other thing is you may have an early menopause. So not just other health problems, but these reproductive problems also are very much high with the smoking. And during pregnancy, if you are smoking in the first 3 months also, it can actually cause miscarriages. There are lots of problems with smoking. So you quit smoking at least 3 months prior to your pregnancy planning. Alcohol also is not good. But then few people say, okay, in moderation. But then maybe for men it is in moderation or once in a while. But for women, again, if you're planning for a pregnancy, it's good to stop 3 months before. So it's always good to avoid, because you want to have a healthy baby. And then it's your mind which is controlling you. It's not that it's something, it's not a disease. You are actually compelled to take it. So try, it's not easy, but try to have a control on yourself. Try to make sure, so suppose you're used to smoking, rather than smoking one every 4 hours, make it one in 6 hours. Slowly you stop. And then you suddenly just have to stop it. You will have a lot of withdrawal symptoms. That's what actually seen more often. But that if you have a problem, see a doctor also, take their help. But then it is good to stop all this, not just for the pregnancy, but for your health, because you're young. You need to live for a longer time and a healthy life.
So we all know that we are aware of that Anu Test Tube Baby. You are one of the directors of Anu Test Tube Baby Center, ma'am. So what made you to start this actually?
Actually, I had a chance to work in UK. That was back in 88. I went there, and very fortunately I could finish my membership, which normally takes years. I could finish it within 1.5 years. And we always wanted to come back, me and my husband, to India. There are people just like after 3-4 years, you don't feel like come back. So we wanted to come back as early as possible. As soon as I finished my membership, I want to do something different. I know it was not easy at that time. In 90s, even in UK, IVF was not done everywhere. It was done in very few centers, maybe I would say 7-8 centers in UK. And so I wanted to do something different. And infertility was actually, I thought maybe IVF, infertility, there's so much of technology involved, there's so much of more, something different, an advancement. So I wanted to learn that. So with lot of difficulty, I could actually go to a place where I could learn. Dr. Peter Bromwich and Andy Walker, they really helped me a lot. Actually, he actually made me do the egg retrievals, do the embryo transfer, really helped a lot. So then once we came back, we established the unit and they helped us in establishing the unit, and then they made sure it's all going on good, because they came here every 6 months, every 3 months to see how the embryos are growing, how the lab is going on. So I really owe my gratitude to them. It's all just because of them. That's how it started. I mean, it's just, I was lucky at the right place at the right time.
Correct. So this has made a path to lot of IVF centers, I think. So because it is the first step of IVF.
Yeah.
So
Actually,
we have a question here.
yeah.
No, actually it is a conclusion. One of yours, she was wanting to thank you. Thank you so much, doctor. It was a valuable session to be aware of understanding PCOS better.
Thank you.
So thank
Thanks,
you.
it was helpful.
Vandita has posted this message.
Good.
So
Thanks,
thank you so much,
Vandita.
ma'am. Last but not the least, actually we want to tell all the viewers that we want to convey all the viewers that previously in insurance, these type of IVF and some other infertility treatments were not covered actually. So these days we have special medical insurance policies covering IVF. So if you want to know more about this, you can call us at our numbers. It will be posted on the screens after the session. But I want to repeat the number. I want to say the number once. So it is 8790-678937. I repeat once again, 8790-678937. So, ma'am, I like to post your number too in this session, so that any viewer is related to some of these problems, or they want to see a gynecologist like you for a better future or better treatments like IUI, IVF, and all. So we need your number to post to our viewers, ma'am.
Thank you so much. But the only thing I want to tell is that I know you're actually providing insurance for the fertility treatments, but the fertility treatments do not ensure a pregnancy. It's not an insurance. That's important, because you have to think about the financial factor also. So when you're taking insurance, you have to pay every month. And then at the end of this, what is going to happen? Nobody knows. Only thing is, it actually gives you a chance to try. And at least 80% of those who plan for a pregnancy and try, definitely it works. That's what I can say. But that it does not mean that, I mean, it definitely going to work out, but there are ways and means to improve your chance of a pregnancy.
Yes, ma'am. At least a hope will be there, no? Someone is guiding me us right. We get lot of hope actually. So it may enroute us with a special thing actually.
Yeah, but we should know the fact and the truth.
Correct, ma'am.
That's what is good.
Correct. It was very nice to have you in this session, ma'am. We thank you so much for guiding us lot of things. So
Thank you.
yeah. So next, in future also, we are waiting for some sessions related to this as a gynecologist with you, ma'am. So we will plan for that also. Thank you so much.
I don't mind if it helps others, yes.
Yeah. So viewers, you can go down to Anu Test Tube Baby Center where madam will be there. This is at Gulmohar Avenue, Villamary College, adjacent to Villamary College, Rajbhavan Road, Somajiguda. So the numbers are, I'll repeat the numbers, please note it down. After that, after the session, you'll get the numbers also. 9494673012, 9494674012. I repeat again, 9494673012, 9494674012. And mail ID is anutesttubebaby@gmail.com. If you have any queries also, you can write a mail to ma'am and they will answer you. Okay?
Yeah.
We will
I would like to thank you all for being here. And one thing I just want to tell you again, this is not done for advertisement.
Correct, ma'am. Yeah. So both of us, we have collaborated with Anu ma'am actually because we want to get more to the women who are suffering a lot with these kind of things these days, which is due to stress, lot of works, and managing so many things. And that is why we have collaborated with Anu ma'am. And as usual, she is the best. So
thank you so
thank
much.
you so much, ma'am. Thank you. Yeah, thank you, viewers. We'll get to next week with more with a better session with another session. Get more from Malapuram. Okay. Thank you,
Thank
Anuman.
you.
Thank you. Thank you so
Thank
much.
you.